Hello everyone, it's me Dr. Saras Bhattrai. Today I am going to talk about the bone of the upper limb, the clavicle. Okay, it is the anterior bone of the shoulder girdle. This bone is non-typical long bone. Okay, why it is called non-typical long bone? Because it doesn't have the medullary cavity and it develops by membranous ossification, and it is the first bone to start the ossification and last bone to complete the ossification. So side determination, how can we decide this is a left clavicle or right clavicle? So for that we have to see the medial end, the lateral end. Okay, the medial end is round and larger, the lateral end is flat, and the upper surface is smooth and the lower surface is rough. You can see the impression and the tubercle here in the inferior surface. So always hold, this side will be medial and this is the lateral. So this is the clavicle of the left side, and the function is it holds the upper limb and transfers weights and forces from upper limb to axial skeleton. So I have already talked about the parts. The medial end, it's also called the external end, the shaft, okay, the shaft, and the lateral end, or it's also called the acromial end. And also one thing I forgot to tell about during the side determination, this could be like this also, okay, because this is facing medially, and here also this is facing medially. So how will you recognize it's left or right? So the medial end is convex forward and the lateral end is convex backward. Okay, so always see the convexity, the convex forward the medial end and the convex backward the lateral end. Okay, so I already told the upper surface is smooth and the lower surface contains tubercle and the ridges. Okay, so I will talk about the inferior surfaces. There is no much things to talk about the upper surface. So the inferior surface will in the lateral end there will be one tubercle. You can see this tubercle, this is called the conoid tubercle, and just from the tubercle you can see a line that is called the trapezoid line. So this conoid tubercle is it gives attachment to the conoid part of the coracoclavicular ligament, and the trapezoid line will gives the attachment to the trapezoid part of the coracoclavicular ligament. Okay, and talking about the muscle attachments, the clavicle will be like this. You can see by yourselves here. Here you will see in the anterior part, in the lateral end, the origin of the deltoid muscles. Okay, and from the posterior border there will be the insertion of the trapezius. The trapezius muscle will be inserted here, okay, from the back. And then coming to the medial end, the medial shaft will contain, see, like this, the big muscles, the pectoralis major. Okay, the clavicular head of the pectoralis major, the origin comes from this side, from the anterior border, and from the posterior aspect and the upper aspect, the origin of sternocleidomastoid will come. And the clinical significance is the most commonly fractured bones in the upper limb also fall in outstretched hand or direct trauma. Okay, the most common site is junction of medial 2/3 and lateral 1/3. Thank you.